Hi everyone, welcome. The Daniel Calazans Foundation publishes weekly interviews on mental and physical health. You can watch our videos here on our website or on our channel on YouTube. Our first guest is Dr. Kiki Chang. He will talk to us in this interview about the importance of comprehensive diagnosis when evaluating patients with symptoms of psychiatric conditions. Dr. Kiki Chang has been working for over 3 decades with pre-teenagers, teenagers, and young adults. And he will give us some very insightful information about this unprecedented crisis in mental health. It's my honor to introduce Dr. Kiki Chang. So let's watch the interview.
Absolutely. That's the thing with mental health issues and substance abuse issues, is that they're always tied together. And the way that people call it is dual diagnosis, right? Is you have a psychiatric issue and a substance abuse issue. Well, even if you have just pure alcoholism, let's just say, there's always going to be mental health issues involved with that. And so it's a little disingenuous to say, oh, it's only a substance abuse issue. No, it's always going to be both. And in most mental health issues, there's a big risk for substance abuse. So it works both ways, and it's all tied together. And that's why I think that it's really important for the Daniel Calazans Foundation and their mission of tying these things together, but not just looking at psychiatric illness or substance abuse, but also looking at underlying medical illnesses as well too. Because there are a lot, and that goes back to your original question, but there are a lot of medical illnesses that set people up for psychiatric illnesses and substance abuse. And sometimes those underlying medical reasons are missed. And one of the earliest patients we saw there was indeed a 14-year-old girl who had the classic symptoms of mania and depression, classic bipolar disorder, but was not responding to any medications, and came to me after 6 months of multiple hospitalizations and being on 5-6 different medications, including 2 different antipsychotics, and not getting any better. And she's a great example of how this gets misdiagnosed, to no one's fault really, because the information is not widely known, and there are reasons that the information is getting blocked by the medical profession, which is a problem, and I'll talk about that in a second. But that in fact, she, a week before her manic episode, had an acute onset of obsessive compulsive symptoms, so OCD, and a lot of anxiety. And that's not very typical, to suddenly have OCD and anxiety and a week later have mania, right? This doesn't happen. So it turns out that she had an underlying inflammatory condition. We were able to take her off of all the psychiatric medications, all of them, and instead treat her with intravenous steroids and stop the inflammation. And then she was able to return to her baseline. It's probably happening more often than we realize, but we just haven't been trained to look at it because there's silos of psychiatry, infectious disease, OBGYN, cancer, heart. But one of the big things that ties all those things together is inflammation. If you look at inflammation, we've known for many, many years that inflammation does go up during manic episodes, during depressive episodes. What we haven't realized is that even before that, there are likely inflammatory reasons that cause those episodes, to cause obsessive compulsive episodes, to cause psychosis, right? May even lead to substance abuse. So I have seen that time and time again. And it gets misdiagnosed and it gets overlooked because that's not the way we were taught in medical school to look for these illnesses. We were taught that psychiatry, we don't know what the cause is. But in reality, for the last 30, 40 years, they've known that there is an infectious etiology for many people with schizophrenia. They just haven't been able to figure out how that works. We can then prevent somebody from having a lifelong of bipolar disorder, right? A lifelong of depression, lifelong of substance abuse, because if you're able to stop it there, then the brain can heal and develop more normally. Once you're in your late 20s, your brain's not developing as much. And so by then, things get kind of hardwired, right? And so these OCD, this depression, this bipolar, substance abuse, it's more hardwired. It's harder to change, and that's when they become psychiatric illnesses that we have to treat psychiatrically, right, or behaviorally. They no longer respond to these medical things because the brain is now more hardwired. So that's the reason it's so important. That's why, foundations like the Daniel Calazan's foundation is so important to look at early intervention, recognition, not just for parents, but also for health caregivers. Medical professionals need to be aware that there could be medical reasons for this going on, as well as other reasons, and to look for substance use, to look for different diseases that may be causing the psychiatric problems. Then we can prevent that from being a lifelong illness. That's a very good question, Patricia. That is definitely something that has received a lot of attention, fortunately, in the last few years, but before that was receiving very little attention. The fact that the young people were having increased rates of psychiatric illness, mental health crises, emergency room visits in the last 10 years have doubled for adolescents for mental health reasons. In California, for example, that's just one statistic. I do believe that our environment has changed a lot with more toxins and more chemicals. I mean, it's not debatable. It clearly has in the last 40, 50 years, right? It's definitely changed. And so what are those toxins doing to our development, to our immune systems, to our brain development? Are there epigenetic factors? And so there's definitely also genetic factors, which I won't go into, that I think they're increasing the risk of mental disorders, but also epigenetics. So epigenetics are things that sort of affect genes, but not directly, but more on a bigger level. Like, for example, toxins can create epigenetic phenomena that change how DNA is methylated and change how then proteins are expressed early on and when they're expressed. So it can really change the way people develop, even without changing the DNA itself. Absolutely, and social media just fuels that. Oh my gosh. When you're looking at the perfect people on social media who have nothing to do except make themselves look perfect and be perfect and travel the world, how can you not be inadequate, right? I mean, I had feelings of inadequacy growing up. I think a lot of people do, but I was just comparing it to the kids in my high school, not to like these perfect celebrities on Snapchat or TikTok or Instagram. So absolutely, I think that's a worldwide phenomenon for sure. Like your heart is beating too fast, everything is a little bit too wired, and you're having trouble sleeping because it can interfere with your sleep. So certainly if you're not taking it as prescribed, you can interfere with all those processes. Also, you may not be eating, which of course is going to affect your health because Adderall decreases your appetite. So all of these things, if you're not being supervised by a physician, could get you into trouble. And I've seen plenty of that happen. I've seen that happen, like you said, at companies. I've seen that happen in colleges. It's very epidemic in colleges, right? And people will be staying up, and it can look like they're having manic episodes. And I've seen plenty of kids, it looks like they're having manic episodes because they're getting 3 hours of sleep. They're totally getting productive, but they're also doing things that are non-productive, and they look like they have mania. They can be doing new projects, talking very fast, grandiose. If we can't all move to an organic farm in Montana with no Wi-Fi, then the question is, how can we bring that attitude towards raising our kids? And can we try to eat as healthily as possible? Absolutely. Can we try to create as healthy a sleep cycle and exercise cycle as possible? Absolutely. Can we have more, interactions with the family and extended family members and whatnot, and create that sense of community and support so that kids don't have to look towards Snapchat or Instagram for it, Can we do that? We can try. Of course not. Now, having said that, we do get a lot more than some other countries do, for sure. But other countries don't have as much of the issues as we do, right? You look at gun control and gun violence, for example, right? You look at this political stuff, and I think about the quality of living in some other countries, including things like Scandinavia, for example. We're not immune to problems. Funding still is never enough, and it's super important. And so philanthropic funding is really the way to go. When I was at Stanford, we realized that, we were well funded by the government, but it just still wasn't enough. And it was too slow, and it was too limited to what it can do. Whereas philanthropic funding really can be much faster, can get in there, and can do a world of good. I've been trying to fight the stigma ever since I got into the mental health field, like 32 years ago now. And we always think it's getting better, and it is. It's slowly gotten better, but it's not enough. I mean, there are some positive signs. Major celebrities, athletes like Simone Biles and Naomi Osaka, for example, publicly put their mental health first, even withdrawing from tournaments. You're right, because it's different when you want to try to give your money to something that is not as well defined, or it looks behavioral, or still has a stigma of being, well, you could just try harder, or you could just do this, or you could just do this, or these people are choosing this for themselves, or choosing a life of substance use. No one's choosing that. I mean, yes, we all have personal responsibility, but these are diseases, these are problems that we can help with. So I agree that there needs to be more destigmatization of mental illness always. And foundations such as Daniel Calazant's foundations and other foundations, every foundation counts, because the more and more is out there, the more stories get out there, slowly the stigma comes down. And it can just be one person to read on a website, say, hey, that's my story. That's my story. That's my kid's story. That's my family's story. I want to make a change. I want to help. And there are people out there, but there can always be more. And there needs to be more. Education. That's something I'm very passionate about, because they are misinformed and they don't read the science correctly, or someone has misinformed them, or someone else has a different agenda, or someone else has a big ego, or depending on what it is, it's very difficult. So we need to fight a lot of different things, but the more and more information based on science that we get out there, I think the better we'll be. And your donation, it's super important. We all can do our part.
Thank you, Kiki.